Hello again, everyone, and welcome to our second edition for 2025 of Pilates 101. My name is Glenn Withers. It's a pleasure to be with you. And once again, I am joined by Kristina Holding. Welcome, Kristina.
Hello, thank you very much for that lovely welcome.
How's it been? How's the last month been for you?
Busy in such an amazing way. Yeah, really good. I think beginning of the new year, you've taken that time to settle in, work back on children, sorting out life, new year, new you, all that stuff. Yeah, settling in really nicely now and everything's moving on really positively. So yeah, I think I said excitement as my keyword of the year for 2025, which is still in place. So that's positive.
That's very good, considering the number of meetings, strategy meetings and discussions we have had over the last month. I'm glad that you're still here and joining in and excited. That's very good to see. So I hope that has been a good start to the year for all of our listeners out there. I hope you, we're here in February, so I do hope that either you were ahead of the game already in December or you have spent some time in January thinking about what you want to do for this year. Whether you're a teacher, a studio owner, a clinic owner, whatever it is, hopefully we're all on track and started. I must say, I am also quite excited by the fact that it's getting a little bit lighter in the afternoons, in the evenings. I struggle with January, I have to say, I really do. I find it difficult to say that because Ollie, one of my boys, it's his birthday in January, so we have to be very careful because he takes it very personally when we say January is such a tough month because it's his birthday month, so he's very excited. But the darkness, I still 23 years, and I still struggle with the endless darkness. So I'm pleased we're starting to see a bit of light.
Yeah, my brother's the same. He's a January baby and he gets very frustrated. He has to make a big song and dance. There's always a huge bit of space involved. Sorry. And that keeps him happy for the rest, all the way through to February.
Yeah.
It's got being a bit less moany.
Yes, it is. All right. So today's podcast. Today, this is really quite inspirational, I think is probably a good word for this. We are speaking to a very learned person, Biljana Kennaway. Biljana is another one of the sort of APPI success stories, if you like. She did our training. She was very impressive. She came on board as a presenter and then she progressed on to a master trainer. And along that journey, she was continuing to educate and develop herself. Yeah. She now runs an amazing facility out in Switzerland called BK Physiotherapy, and she offers physiotherapy and Pilates services out of there and does so much more besides. I think that was one of the takeaways that I learned speaking to her. She is doing a lot of different stuff, right?
There must be 8 or 9 days in the week in Switzerland because I certainly could not fit all that in. When I was talking, and you might get this, listeners, when you listen to this interview, fantastic. If anyone is familiar with Harry Potter, Hermione Granger in The Prisoner of Azkaban has a time turner on a necklace, which allows her to kind of put back in time to be able to accomplish more tasks. Biljana must have one of those. We're all the way somewhere because, inspirational is definitely, she is, as for me personally, as a physio, Pilates instructor, mother, researcher, guest lecturer. She's all the things which for me are, just some things I've done, but not to her extent and not all together. So yes, she is really incredible.
Yeah, absolutely. And I think the other thing that came across to me is, again, and we saw this, a little bit with Dawn, who we spoke to in the January episode, who was just, very honest, very down to earth. Biljana, when you're talking to her, just so humble. We kept trying to build her up.
Yeah.
Build her up with all this. Oh,
not interested.
Like, oh no,
she's not interested. Yeah, very modest, very, very modest in her accomplishments, which makes it all the more interesting to listen to, I think.
Yes, absolutely. Well, look, before we tell you guys too much more about the chat, it is a really fascinating chat. Biljana's going to take us effectively through her journey, and it's quite an interesting journey. This episode has probably that sort of link and insight onto the women's health side of physiotherapy and Pilates, because that's Biljana's specific interest. But it's also interesting how she's taken that interest and then applied similar things into sort of just exercise and activity as part of her research that she'll talk about, which was very, very fascinating. So, guys, we will hand you over to the interview now, and we have a fascinating chat with physiotherapist, Pilates teacher, APPI representative in Switzerland, and APPI master trainer for the Women's Health Program, Biljana Kennaway. Well, hello everyone, and welcome to another edition of Pilates 101. I am delighted with our special guest today. We're going to have a deep dive into the world of pelvic health, pelvic floor, and a whole bunch of different evidence and research and conversations around that specific topic. So let me introduce Biljana Kennaway to you. Biljana is a long-standing colleague and friend of myself and Elise's, and a colleague in relation to APPI as well. I'm going to list your long list of credentials here in a moment, Biljana, but firstly, thank you for giving us some of your time and welcome to Pilates 101.
Thank you for having me. I'm really honored and I'm looking forward to having a chat.
Excellent, good. And as you guys can see, we've got Kristina here with us as well. Kristina will be diving in with her various viewpoints and questions as we go along. Morning, Kristina.
Good morning, everybody.
Morning. All right, so let's go through this, Biljana. Biljana's qualification. I'm going to start with qualifications to give the audience out there an understanding of just the level of quality information, the level of education, and the level of expertise we are talking about here. And you can jump in and correct me if I've got any of these wrong, but from my research before our chat here today, you started with a BSc in physiotherapy in 2002. You followed that up with a European Masters in Business Administration in 2003, which is an interesting little leap there, so we can have a chat about that. And then it looks like you found your niche and your special interest area. You sort of defined your career going on from there. And in 2018, you did the postgraduate certificate in continence, followed up in 2021 with a postgrad diploma in advanced clinical practice, and then took that to a master's level in 2022 with a MSc in advanced clinical practice in pelvic health. I think that covers it. Does that?
I think you forgot my APPI certification. I'm really proud of that because actually that led me towards some other stuff that I decided to pursue.
Yes, very good. I appreciate you putting that in because obviously let's go to the many hats that you wear, shall we say. So you have your own clinic and your own practice called BK Physiotherapy there in Switzerland. You are obviously the APPI host and master trainer for APPI in Switzerland, which is obviously the most important of these many roles that you have.
Quite right.
Absolutely.
Yes. Quickly followed up by your role as an assistant editor for the POGP Journal here in the UK. You're an honorary lecturer in Switzerland on the BSc and MSc programs in pelvic health and sports physiotherapy. You teach your own courses in pelvic health. You teach on the point of care ultrasound courses here in the UK in relation to pelvic floor and pelvic health. Yep. You lecture for the Swiss Association of Strength and Conditioning as well. And I think I've got most of that. And then you've been telling us you do a whole bunch of other stuff for corporations and anyone else that will give you the chance to promote the importance of pelvic health.
Yeah, that's correct. This is definitely my passion, and it's definitely a niche I found where I feel happy, and it often feels effortless, but often, you have to make a great effort to make the wheel moving. But in all of that,
it's hot and wet, fine.
In all of that, I do have Pilates in the background, and it's actually something that is all the time going in and through all the other skills that I that I maybe use during the day in a clinic and also when I'm presenting. So it's great to sit down and talk to you about that and how actually APPI and Pilates influenced me in my career.
No, excellent. We are going to delve into all of that. As ahead of our chat today, everyone, Biljana sent me a whole bunch of research articles that she has published, and more in action at the moment, including a chapter in a book that I'm quite interested to explore. And we'll get into that in a moment around load management of the pelvic floor as well, which does sound interesting. And I'm reading through one of the articles here. I can see that you have investigated a lot in relation to pelvic floor and pelvic health in terms of load and all sorts, plyometrics and running and all sorts of different elements to how pelvic floor handles load. And we will get into all of that in a moment. But I want to just take a step further back, because what I often think is really interesting is you're now at such a high level in relation to your profession and your specialism. And that takes a lot of work to get there. But when you start out, I don't know, maybe you always saw yourself going there, maybe you didn't. But why don't you take us back to what brought you into choosing physiotherapy as a career to begin with?
Oh, well, this is a story I'm telling my children at the moment a lot. I went through the secondary school, or we call it a gymnasium, that is very academic. So it was loaded with math and physics. And then afterwards, I wanted to just go and study astronomy. But my dad knew that I wasn't the personality for sitting down for too long, and I wasn't really interested then at that time in academia. I was more interested in sports, so I didn't know how to integrate all of it. And I was very sporty. I mean, needless to say, I was going to school on my rollerblades, and then I was hiding them in a rucksack. I was a hideous kid. Anyway, my dad actually led me towards thinking about what are the professions that integrate sport, what can I study that it would make me happy, and it would make me happy actually to get myself dressed in a sporty way and do whatever I wanted to do as a kid. And I still think that age 17, 18, I was a kid. So this is how I found physiotherapy, and I immediately fell in love, and suddenly, studying became easy. And this is how I ended up in the UK. And then when there was one little wobble towards the end of the studying when I thought, well, maybe I should have actually studied business, or maybe I can integrate business in medicine. So I went into doing MBA as I got my first job as a physio. And then I decided halfway through that, no, I have no interest, neither in finances, neither in management. I like to be a clinician, and that's what interests me. So I actually brought just that knowledge to the clinic. And I always said from the beginning, don't ask me to be the manager. Don't ask me to look at the finances. Give me as many patients as you can and as many academic papers as you want me to read and appraise. And this is how it all started.
Okay, interesting. Oh, very good. So tell us then, you've gone from, this love of being active and sporty, as you say, and you brought that into the world of physiotherapy. You've had a look at the world of business. You've come back, and as you said, your passion was in clinical based work, not so much the management side. You touched on there that movement and research and all of that aspect of it was what excited you. So how did you then find your way to Pilates? How did Pilates find its way into this long list of academia that's in front of me?
So that was an interesting journey, because I was at Imperial College, an assistant to Professor Alison McGregor. She was doing a long study on looking at circuit training for low back pain patients. And then at that time I was running this circuit training, and I was questioning, like, this is also very general. This is not what I'm doing in a clinic. And then I got the back pain going skiing, not while skiing, but whilst actually getting on a ski chairlift. And it was so bad that I kept worrying that I was going to be disabled. I mean, it was really bad, but I actually bottled up and I really pushed through every single pain and neurological symptoms I had. Ended up having an MRI, and I remember then consultant telling me, unless you start doing this core stability, I think I'll have to operate. I was like, oh, everyone's talking about this core stability and we are doing this circuit training. Let me have a look into that. And I remember at Chelsea and Westminster, only one physio was then trained through APPI. I think it was only level 1 she had. So I followed her steps, but I started with a different Pilates school. And then when I moved to APPI, everything just made sense. The way you were presenting, the way physios were integrated in a Pilates world and made think and clinically reason. So I started following you whilst I was actually practicing on my own. And then Chelsea and Westminster actually supported me further because I was then moving into a women's health. So I continued with antenatal, postnatal, and the rest of the CPD. So it came as an experience, and then I just went deeper into it. And this is how I ended up following APPI method.
Okay, great, lovely. And then that progressed on, and I'm looking at these dates here, Biljana, and I'm looking at the postgrad certificate in continence in 2018. I'm trying to remember back. I'm pretty sure that was the year we had you over at our London conference, wasn't it?
Yes, it was.
Yeah.
And it was your conference actually that led me towards the Bradford postgraduate certificate. So I think, as you remember, I started becoming a presenter, then I moved to Switzerland and I continued flying, and I was pregnant, heavily pregnant, flying for Chelsea and Westminster, flying for APPI. And I was pushing boundaries then in pregnancy. So at that time, the guidelines were saying that we shouldn't be doing maybe planks, that we shouldn't be pushing our levels of exertion if we didn't exercise at this particular level. So everything was like a maintenance, or please don't engage if you haven't done it before. And I was one of those that, why couldn't I do it? If I feel okay, I could do it, because I was doing Pilates all the time. And at that time I was running 5 classes a day because I started doing well-being for UN. I had lots of private clients. I had lots of patients that just wanted to do, you integrate Pilates or wanted to do trial Pilates for different conditions. So I consider myself pretty fit in terms of Pilates, but I was also on a bike riding to and from UN, up and down the hill in Geneva. And it was really hot. It was like 32, 33 degrees Celsius. And I was on a bike, heavily pregnant, 7 months, 8 months, and they were telling me I shouldn't be doing it. So I explore that on myself, and I think participants were always looking at me in horror, and I would always say, hey, this is normal movement for me, don't follow. And this is, I think, when I started speaking up a little bit about what is a normal movement? Why are we not allowed to do it when we are pregnant? Where are the guidelines? What are the limitations of them? And I spoke at a conference, I think it was about a postpartum recovery as well. And one of my colleagues came up to me and she said, you're doing so much work, you should be doing the Bradford. And I think I got my second baby then. We were updating the manual for APPI, and the amount of work I put in, my colleague said, come on, you could have finished your postgraduate doing this amount. So when I went to postgraduate certificate, it was really, women's health part was really easy. The continence part was challenging. And there's a reason why I loved it. So APPI again set that path, kind of pushed me towards the next level. So yeah, it was the opportunities that APPI created, just naturally. So nothing that I had it already in mind that I followed. These were the opportunities that came, and I really enjoyed them, follow them, explore them, and then the next stage was in front of me.
Oh,
I
awesome,
love that.
awesome. I remember that. Well, I think I remember that session, because didn't you have like people like crying like babies, or a model crying like a baby or something, because we're in the middle of a Pilates conference, and then all these weird noises coming from Biljana's session, and everyone came out saying how amazing it was, and I was presenting, I think, at the same time, and I was like, okay, so what's been going on in there?
It is. It needed to simulate the real atmosphere in postpartum class. So I was running lots of postpartum classes from Chelsea and Westminster to my private ones and here in Switzerland. And then I ended up only having 5 or 6 moms. But the only way you can get commitment and compliance and attendance was basically allowing them to have their babies around. So the classes would be smelly, loud, sometimes moms would be stressful. So you just need to kind of go with it. So not stressed about the noise, crying, and then wheels of the buggy being muddy. All of this we would sort out and just accept.
I love it.
So that's what I wanted to paint in at a conference as well. So I think I had lots of colleagues playing baby crying sounds during the session, and other people were just turning around and asking what was going on. And I was just like, that's okay. If your baby's crying, just attend your baby. You can change the nappy, you can breastfeed, join us when you can, or you can position your baby in this way, continue breastfeeding whilst we are doing, for example, side lying series.
Yeah. It's funny because actually just a few weeks ago we had our APPI on tour in Oxford, and Emily Elgar, who you've supported through and has now come up to master trainer level with us as well. I think she was recounting the story of your session and the noises and everything. It's still infamous in the world of the APPI conferences, shall we say? Now I want to just delve back just a moment, something you spoke about there, which really intrigued me. And it reminded me, I think I was even speaking to you, Kristina, about this just the other week as well. And you're talking about this concept of you being pregnant and going through your exercise and what felt right for you, even though the literature may not have been up to speed at that time, and you were thinking, well, I feel fine. I know the sort of condition I'm in, so why can't I do this? And I remember Elisa telling me quite clearly, coming home from the gym, I think it was with Jasmine, our first child, and she was quite heavily pregnant, and coming home from the gym, and she was appalled because one of the gym trainers came up to her and tried to give her advice about what she shouldn't be doing, given how pregnant she was. And Lisa's very polite most of the time, unless she thinks somebody has no idea what they're talking about. So she politely turned to this young man and said, "Oh, thank you for your advice. I find that really interesting. What reference is it you're referring to when you give me this advice?" He went bright red and slowly walked off and said, "I think I'm going to leave you to do your exercise." But it is that concept of, and I guess we created APPI on the concept of the same thing about, okay, you're looking at, there's evidence around, and then you're looking at your own experiences and your own thoughts and looking to say, is this right, or is there another way to look at it or think about it? So why don't you sort of just expand a little bit, I guess, on how your own experience of that time of your own body going through pregnancy and what it really is enormously capable of, and what lessons maybe that brought to you that then went into, or sort of how you've developed some of the amazing work you've done as you've progressed on.
I remember there were moments when I was a little bit scared if am I doing too much, lying down supine, and we had to always justify why you are allowing someone to be in supine position, and is it inclined 30 degrees, 45 degrees? I remember this all times. It was so strict, but I remember being absolutely fine and waking up in the middle of a night, in the morning, lying on my back. And I thought, well, I feel fine. is my baby all right? So I would often go to my obs and gynae at that time, and she knew that I was a pelvic health physio. So I would just ask, can you just quickly scan my baby and just tell me that everything's all right? Please do the examination. So I was almost like being examined on a regular basis, and she agreed to actually do it because I was flying to the UK to work in a Chelsea Westminster at that time. But I remember actually having a big scan towards the end and performing hundreds, level 5, in front of professor radiologists and obs and gynae, and asking them, please interpret, am I damaging now anything? Am I compromising my baby? What's my pelvic floor like? So that was the time when I didn't use the ultrasound, right? So I had to really look at these black and white images and try and also understand what I'm looking at, what they're telling me. They were shocked, right, what I was doing, but they agreed that I wasn't compromising a baby, but maybe pelvic floor, but they couldn't confirm. I showed them the pelvic floor contractions. They said it was correct. So everything was visible on ultrasound at that time. So I took that forward, and I really felt always good. Every time I did my Pilates, I did planks until a bump was touching the floor. And I remember doing these planks over the gym ball with my feet on a gym ball or with my hands on a gym ball, and people telling me off for doing it. Or participants, I had to say, I'm doing it, but you shouldn't be actually advising your pregnant women to do that. But that's normal to me. And this is how I started following amazing work by Linda May. She's still producing amazing work in especially in pregnant women, and she's following fetuses rather than just looking at mother and well-being of the pelvic floor. Actually, she was convincing me more and more that it was okay to exercise in pregnancy. It was okay to keep the strength, to keep the ability, to keep even progressing in your skills. And then luckily the guidance started changing. But these are the times when we are pushing a little bit the barriers. And I think this is what I've noticed as well with APPI. When I embarked on my studies, I've noticed that trying to find if Pilates is effective or if adding transverse abdominis would be more effective than not, for example, to pelvic floor muscle training in urinary incontinence or any other condition, it was really difficult to do that because the exercises that I would choose maybe for one person, it would be totally different for another person. The methods, Pilates methods really vary, as you always said, and you always taught us. And I followed then Stott, then I went with Michael King, body balance. I explored so many different teachings, attending their classes. I ended up now recently in La Gray method, exploring their reformer. I've got lots to tell you about that too. And then again, I'm coming back down to clinical reasoning. So it's so difficult to define effectiveness or to measure effectiveness of Pilates in today's evidence because the methods are really variable. But when you look at individual basis, and when you clinically reason how you would integrate, why would you integrate, and which muscle at which point, then it's totally different story. So to me, then case studies made more sense. And that's the reason why I wrote one of those case studies when they asked me, particularly with the use of Pilates. So yeah, I think this is where I was going to with answering your question. But now everything that we do, and I think this is why I like the kind of academic part of our profession, is because it's not really just sitting down. You read a paper, you stand up, you scratch yourself, you start writing down the thoughts, and you're thinking like, no, I have to try it. This doesn't make sense. Then you're looking at the statistics, and nowadays we are pushing the barriers, or we are exploring, can we do the weightlifting? And this amazing work from Laurie Fauna, from Kristina that is actually showing us, hey, again, there are normal movements. There are, again, weightlifters that have been doing it before and during pregnancy. It's safe. We need to explore a little bit more different elements like Valsalva, like cardiovascular system changes, etc., etc. So that, again, the CrossFit bed kind of like label to start doing it in midlife or before, after pregnancy as well, so earlier, led me towards doing it. So I would go to CrossFit, and I think we did one of the workshops during COVID. So I presented how to go back to CrossFit using Pilates method. So even now, when I go into CrossFit, I'm probably one of the worst there. I always do the scaled version, but I love it. It makes me feel like a kid. You climb a rope, you do handstands. You know, my favorite is jumping on a box. That's my absolute favorite, and I excel there. But the other thing is, like, I go around. People come and tell me they have a back pain when they live. Let's say they lift 70 kilos deadlift. Or when they're doing snatches, they have problems with shoulder. So then I would look and I would tweak. And often it goes back to exactly what you taught us. Position and think about what is first going to stabilize and what is going to, which are the part of the body and muscle groups you need to perform a movement. So sometimes I just approach like that. So I feel like I'm using my Pilates thinking that came from APPI in nowadays treating my CrossFitters. And then I use that, you know, in my Pele Health clinic, everywhere, in sports from sports performance to prevention to my Pilates group that I call a social club. I think it's it's everywhere.
Yeah. I mean, look, that is, I mean, there's so many nuggets of information that you've just expelled in that little conversation. So I'm going to try to come back and unpick a few of them, because you've also, as you've spoken there, touched on some of these articles that I have in front of me. And you touched on there the link between, does a transversus abdominis activation enhance pelvic floor control? This particular literature review is what I'm talking about when I was reading through this. So why don't you give us a little bit of a sort of background of this literature review and what the learnings were. It is Journal of Pelvic Obstetric and Gynecological Physiotherapy, Spring 2020 edition. So if you guys are listening to this and you're looking to get it, that's the reference there. Kennaway B and Karras C. Have I pronounced that correctly?
Yes, absolutely. Yep. Yeah, sure.
All right. So it's a fascinating read. You go into a lot of detail within the literature review here. So while we don't expect you to, you can probably sprout on for this for an hour. Why don't you give us the sort of summarized version of why that question came about, what led to the study, and sort of the findings and the outcomes from that.
So I think we always discussed in Pilates, right, in teaching, that do I need to use my transverses for 60 minutes? Do I need to pre-contract for every single movement? That was my first question always. Do I need to do that? Is the same then pelvic floor became, oh, maybe you can use the pelvic floor as a pre-contractor, as a stabilizer. And I was like, well, do we need to do that consciously for 60 minutes? So these were the first questions that I needed to, and I wasn't really convinced about 60 minutes, like the whole Pilates class and doing the pre-contraction for everyone. And then it led me, okay, so let me have a look. Why are we now we are using both? Can we enhance the pelvic floor muscle training? Can we enhance the effect at the end? We know that the pelvic floor muscle training is effective. It's a first-line treatment for urinary incontinence and pelvic organ prolapse. So if I add a little bit more specific training and I add the coordinated movement with the primary sling, am I going to get quicker the outcome, positive outcome, or am I going to get like a stronger pelvic floor and less symptoms, and et cetera, et cetera? This is how it led me to look at those approaches and literature that use the Pilates as a method of pelvic floor muscle training. So they had to integrate pelvic floor muscle training with Pilates. But actually, it was one of the reviews done by a Norwegian team that didn't make sense. So when they looked at the literature that they used in their review, they basically mixed and matched. So there were some actually studies that were using just transversus abdominis in order to measure symptoms of urinary incontinence, so without the pelvic floor muscle training. And then there were some other papers that were using both transversus and the pelvic floor muscle training. So first of all, as a clinician, I would always use pelvic floor muscle training for anyone with urinary incontinence or pelvic organ prolapse. Now, I need to define this a little bit more. Pelvic floor muscle training is not just doing Kegels, as many of my patients think, as many of the public puts the hand up and tells me they know what they're doing. Because we don't do just quick flicks. Lots of physios think that we do that. And that's the thing that I always say, pelvic floor physios or pelvic health physios are not doing the training and learning how to contract and release. They are learning, they are actually enhancing the muscle, the whole of the complex, not just the muscle, but the whole of the pelvic floor complex. They're enhancing to actually be part of the full coordinating system inside one a body, and to be able to respond to everything that comes from outside and from any demands that the body inside needs to respond to, needs to cope with. So that's the reason I didn't like the paper that was stating that transversus abdominis doesn't have any role. And then I wanted to do the literature review. So I was actually clearing this a little bit of this ambiguity in the paper. And I wanted to actually say that there is a theoretical probably path to lead us to think there is, but we have problems with heterogeneity especially in Pilates method. So that was one problem that I found. But the other problem that we need to touch on is actually, what are we trying to do when someone has a symptom of urinary incontinence, for example? Are we teaching these women, if they have a weak pelvic floor, if we need to do the strengthening, are we teaching the maximal pelvic floor muscle contraction or submaximal? So these are the differences as well. Then it comes the question of breathing. How do we integrate breathing? Do we need to integrate breathing? Is it important? How do we go back to sport? So from that paper onwards, I had even more questions, and I don't know if you want me to just continue, but I'll just give you just kind of like one timeline of all these thoughts. It started, when you go back, we know we started with Kegels in 1948. Okay, and we are really grateful, 1948, and that's the reason why I tell my patients, we are probably the first generation that we are going to change, how we age and what we know and how we prevent and treat the pelvic floor muscle dysfunction. But then in some 1990s, we started the concept of core stability, and Paul Hodges, Ruth Sapsford, all this beautiful research that came out was telling us that integrated work of transversus, pelvic floor, diaphragm, multifidus, and then we were focusing on that, which was brilliant. But then in 2007, I think, and onwards, we got Talzo study and all other studies in diaphragm and pelvic floor. And then what we found in the in the experiment that we were doing, a feasibility study at Brunel, everyone is starting to teach pelvic floor muscle contraction with exhalation. And that was interesting for me to find out. And I think the girls in the episode 34 addressed as well that we went with the breath a little bit too far. So it's okay when it's used in clinical setting. Am I going to use diaphragm or breath to facilitate the pelvic floor, to relax or to contract? Depends what I want to do. To pre-contract, to respond, maybe. But I'm definitely not going to be teaching in a group setting women that have never been investigated or assessed for the pelvic floor correct activation. I'm not going to be telling them, oh, you should contract it only when you exhale, because we are putting a different motor pattern it takes a long time to unwind. That muscle works all the time. I'm talking now and is doing all sorts of ups and downs. I'm waving with my hand because I always do. So this muscle works at this automatic level. So how do I rehab pelvic floor muscle in order to support me for all these activities is what actually led me towards also load management and sports performance. And also I have lots of opera performance from the opera house, from theaters. And so they're also performers. That, to me, they're also athletes that we need to support in a pelvic floor health. So these are kind of like, these are the themes and the little bits that I kept following. And it's always that question: how much is needed for my patient in front of me to support, to enhance, and how much is too much? And how can I apply that in a group setting? So how am I going to teach transversus abdominis? And I think we all changed, right? So unfortunately, I still see it in some general classes, how even physiotherapists at uni, when I ask them, okay, show me how you teach transversus abdominals, what do you understand with that? And they're still putting their thumbs, and they're really palpating for a long time, and they're trying to explain how many percentages they want to, and they're all getting into the obliques. And it's basically, you can just do a simple thing. Just ask someone to do something specifically, precisely, and tell them to focus on one point and move through the other point and feel. You will get a response, either right on time, it might be delayed, and if it's not there, then add extra parts that actually you can facilitate the transversus or pelvic floor or any other part that you're trying to facilitate, maybe deep neck flexors too. So this is how actually things have changed. So I went from the pelvic floor, how it started from just Kegels to being integrated in the core stability, to then being really tight linked with exhalation and inhalation in terms of release and activation, to now, hopefully, I think we are coming to the point where we need to understand that it's very individual, that the muscle is working all the time, but there are different elements where we can enhance and facilitate. So we just need to be clever, and we need to know how to use these parts. But we shouldn't be actually teaching someone, okay, you contract only when you exhale, because we are really adding something that doesn't need to be there. Is not natural.
Okay, excellent. Very so again, in terms of this particular podcast, I know people often listening to this when, say, for example, they're out walking or they're out running. Sometimes they're driving their car and they've got this on in the background. So what would be the sort of the quick takeaway from all that timeline that you've just taken us through? Where are we right now, and sort of what are the key messages that you would put across in relation to the the activation strategy, linking specifically in relation to pelvic health, and then the sort of this particular article that we've got in front of us, which was sort of asking the question that does the addition of a transversus abdominis activation assist in incontinence? Where did you get to at that point?
So let me answer the first question to you. So in terms of the activation and pelvic floor, is there a position that is maybe the most optimal for all? The answer is no answer. Basically, I found that lots of women were unable to feel the activation of the pelvic floor in supine position, and this is our standard position, crook lying, for examination, for internal, and for even transabdominal ultrasound or perineal. But I found that actually, as soon as I stand them up, or I actually turn them inside lying, where you can add a little bit more proprioceptive feed, suddenly they connect. They're able to feel and interpret the pelvic floor contraction. Or you could see it on ultrasound that their pelvic floor contraction is greater at that point. So to me, when when I'm examining someone, when I'm looking for the pelvic floor, for example, contraction, I don't just define yes or no in crook lying. I explore in every single position, and we explore in standing. And then we are exploring it in different positional tasks with transverses, and the transverses, again, is not that I need to go straight in with someone who hasn't done Pilates, who doesn't really know what we are doing, but I could actually get these transverses to work through different cueings. And this is where learning imagery with you and tactile as well, feedback was fantastic, because it really brings all these different points how you can teach someone to recruit transverses. So does it enhance adding transverses into the pelvic floor? Well, they are working together, and not just the transverses, but all other muscles. Yes, it does. I would say clinically, from my observation, it does enhance. And it's not, again, just the transverses. The transverses, diaphragm, pelvic floor will respond really well in a task. They will do a coordinated movement, but also how they absorb that task, how they absorb load from, for example, when you're jumping, when you're singing, when you're screaming, but also depends on what's happening in the upper body, what's happening with the rib cage placement, what's happening with positioning of the hips, all the other things. Extended core that we are talking about is not just about, if I have a coordinated transversus pelvic floor multifidus diaphragm, that I'll be spare of pelvic floor muscle dysfunction. Well, you may actually experience it if your upper body or your extended core doesn't respond well to a task. So, in jumping, in running, you are absorbing load from one to another side. So we can just simply say, okay, so you are taking load and you're absorbing through the leg, through the hip, through pelvis, hip, knee, foot, from one to another side. Well, that's one thing, but the other thing, you have to look at the rib cage. You have to look at the upper body, arms, how you respond when you become a little bit short of breath, how you respond when you're reaching the exhaustion, what changes in which part of the body that influences how you absorb load through the pelvic floor, through the pelvis and the pelvic floor. So the reason why I started looking into it, because I would have women who have amazing pelvic floor muscle strength. So you first go with your assessment to establish, what is the pelvic floor muscle function like? Do they know how to contract and release? What's the strength, coordination, timing, the rest of it? And then when you find out that everything is actually really good, why are they leaking when they're performing? And then they're looking at different things. So then we're looking at the biomechanical stuff, you're looking at the psychological stuff, and all sorts of other things that are inside and outside our body that can influence how you perform a task. So for example, in CrossFit, for example, I find women like with skipping, we know, and a double under, this is always the most aggravating task. But when you see how they do it, when they're becoming a little bit more tired, they're changing the way the upper body is positioned. They're changing the way they are breathing. They're changing the way they're absorbing the load through the knees, through the ankle joints, through the hips as well. All of that has an impact on how your pelvic floor is going to respond, yet alone thinking about the physics. So you have uterus, you have bladder, you have urethra, then bony parts of the pelvis, and you're going up and down all the time, vertically up and down. So all these different parts are hitting, maybe on ilium, maybe on pubic bone, maybe the bladder is hitting on uterus because it's hard, and it might be hitting up at the top, and you leak when you're up in the air, not when you're hitting the ground. There are so many different elements to consider. What is going on? What's the pelvic floor, or what's the visceral mobility like? in individual. But then you can think, actually, how can I change it? Sometimes with this mobility issue, I tell women, as soon as you feel that you've got one more jump in reserve, start changing it. So then instead of doing the single jump, do the double jump. If you're doing double jump, you're doing single jump. If you're doing it on a spot, you suddenly start changing and skipping forwards and then in a circle, so that we trick the brain, but we're also tricking the vector of movement inside visceral, pelvic floor, also the biomechanically the whole of the body, so the legs, pelvis. All of that work is going to have a little bit of influence on absorption. So pelvic floor will continue to work, and you don't have to worry about it. So these are the little elements that I like to explore and play with. And another,
I love that. Tricking is so lovely. I love that. Tricking the body is fantastic. I don't know if anyone has heard me speak before, but I normally can't shut up. I am sitting here like I'm so absorbed in you, Biljana. Yeah, all that stuff is just so fascinating. And I think that tricking is just something which I think a lot of people don't think about, because it's still very Kegel, breath-based. It's fascinating. This is great.
It is, and I think for a long time, and still lots of my colleagues in physiotherapy perceive us pelvic health physios as the ones who are doing Kegels. And when they hear what we do and how much how much in depth we have to go in musculoskeletal, biomechanical, psychological evaluation. And for example, this is another example where it was actually happening during my course. So one of the participants said that she's been putting up with incontinence for a long time, and she was happy to stand up and be investigated to be my model. So we looked at her running. So she's been running. She was already in her mid-50s. So she was running for over a decade, always experiencing incontinence whilst running. She also had rectus diastasis, so she wanted me to take her forward. So we did it, and I put her through the jump test. Again, another thing that I modify that is not validated, because it can't be, because it has to be always individually scripted in a way. So I always push them to the point that they actually get their symptoms, so that we know what is the minimum, what is the maximum, how we start the rehab, and return them back to their activity. So with her, for example, I said, right, this is how I would do it. We would assess, and we went through the assessment. Then I said, the next thing is now jumping. So she looked at me and she said, jumping? I said, yes. So I'm going to ask you now to jump, but you're going to jump in this and that position with this and that alignment. And she just looked at me and she said, I can't do it. And I remember I had 25 students behind me. And I said, why not? And there was a huge mirror in front of her. And that was a little bit embarrassing. I was like, why not? And she just whispered, she said, I don't have a pad. I think I'm going to leak. And I said, and now you have to trust me. I changed lots of things. You're going to jump and you won't leak. And I went, so it was like everyone started talking around, and two of us had a little conversation, and I could see that she started breathing and she calmed down and she calmed down, and she said, okay, I'll do it. And then she jumped and she started crying. I said, is everything okay? She says, yes, I haven't leaked. And this was brilliant. So that was, to her, I was able to demonstrate that actually, if you change a few elements, we can expose you to jumping, but we can't carry on. We have to reach the point that you have one or two in reserve. So you feel before you fail that this is where you need to stop. But I certainly had people where they told me, I can't jump, I already smell urine. So they had such a engraved experience of incontinence and embarrassment that it would be the last thing that I would like to put them through, and the system wasn't ready to be put through. So we would work on different things, from so graded exposure to imagery. So all these different tools that you can use before you actually make someone ready psychologically, with the nervous system, with your physiological and biomechanical system to respond to a greater load. So sometimes we need lots of time, sometimes we can do it pretty quickly and determine where the load is acceptable and what is pushing it with the symptoms.
I've really enjoyed that you've spoken about the psychological elements of kind of pelvic health as well. You've said it like 4 or 5 times, and that could be a whole nother podcast, I'm sure. But even doubling right back to that initial story about when you were at our 2018 conference and you brought in all of the kind of different variables into the room, you know, babies crying and muddy wheels on the pushchair and things. There's such a negative connotation when it comes to pelvic health and postpartum fitness, and even that story then, you know, I can't jump. This visceral fear of jumping, and I'm with people and I haven't got a pad and I'm not ready. And you, even in that story, like you're instilling that trust and that confidence is such a huge part of that. And I think, and you have written it in one of the articles as well about that psychological variable. And I think that's just fascinating that you're bringing it in when you're talking about CrossFit, when you're talking about your corporate people, when you're talking about your 50-year-old, you know, who are struggling with continence issues. It's all, you know, similar variables, but you're just bringing them in at such a different level and different times to really understand individuals. I think that's just great.
I think this is really important, and also it's important for them to realize how much that is impacting the continence system. And it's again, I'm going to go back to some of our first lectures at MATVA certification lectures, where Glenn, you were showing at the time, and I even wasn't using ultrasound, and I was looking like, oh, I want this piece of equipment one day. And you were showing us transversus abdominis and intra-abdominal pressure and the impact on pelvic floor and the bladder itself. And you know what? I'm using it now all the time. So my little portable ultrasound, after I've done research, I told my husband that's all I want for Christmas, and he was kind enough and generous, and actually very happy that I finished with studies. So he bought me a portable one. It's in my handbag and it goes everywhere with me. So in a CrossFit, for example, they come and say, but why? I was like, well, because now it's towards the end of the class and your intra-abdominal pressure probably is high. Let's have a look. And you can just have a look. You go and scan the abdominal wall. Oh my goodness, they are gripping through the abs and they're working so much. And you could see that there's a little bit of a pouch down in the lower tummy. And so you can see that the system is not responding properly, and you can tell them, okay, so now we can breathe. They would always look at me, are you serious? I said, yeah, you can go back and skip. If you just give me really few good breaths and we breathe through the abdomen, we breathe through the rib cage, we let go of everything, you will be able to skip again. So we just unlock some of the kind of freezers in the system, and we ask people, go and do it again. And as soon as you feel that that is too much for the trunk, for the body, you need to just come down if abdominals are enemies. But sometimes abdominals are friends. You know, we need superficial abdominals as well as we need our transversors, but we don't need to be gripping with anything in it.
It's almost like a reset of the intra-abdominal pressures. You know, it's building. Those structures are kind of failing. Okay, just stop, reboot, reset, get the intra-abdominal pressures just a little bit more relaxed, and then you can keep going.
Exactly. So it goes back to, for example, teaching someone scissors level 2. Okay, really hard exercise, right? I remember after my second baby, goodness, it took me good 4 months after giving birth to get back to do few only, and oh my goodness, was I shaking. So teaching that exercise, for example, you can't tell them do it 8 times. You may actually get really nice 3 or 4 reps. And then I tell them, now get down, like reset, take a few breaths. Let's go and do it again. So the same concept. So you just take it into a different environment and with a different task. And maybe reset, realign, position the system and the muscles, the mechanism that is working, position in the optimal position and the optimal way to work and to support us.
Yeah,
whether the pelvic floor, whether anything else. But the pelvic floor, the problem with the pelvic floor, it's a silent, right? So the symptoms we feel through the pelvic floor,
symptoms.
yeah, they're silent. And it might be that it's actually only a problem with the endurance. So if you're training for triathlon, and Glenn trained a lot, we know. And then it comes, so this is going back to your psychological factor. Then it comes the day of competition. Day before the competition, people are already apprehensive. It's excitement, but it's also nervousness. Are you going to be able to cope with the temperature where the competition is in a different country? Are you going to be able to, is your bike going to hold? You're not going to have a puncture. Are you not going to get blisters when you're running? Is the water going to be too cold when you first jump, when you first start? Crowd. There are so many factors going through one's mind, and actually already changing the way we're going to start a physical task. So I've seen it a lot, especially in competition. So during competition, it's a big question mark what's going on with those who have experienced the pelvic floor. And I think this is the hardest one to train for. And the load is so much greater during competition than it is during any other time when we are training. And these last few miles before the finish are the hardest ones for us to think about. How am I going to make you symptom-free for these last few miles in competition? And this is why I like the work from Tim Gabbett, because he works a lot with athletes and he goes through the, how far should I push them? I need to make the training really messy. I need to take them to the dark places. And conversation I had with him was really inspiring, but how much is too much and what is really needed to keep the system working well and not to be distractive or disruptive.
That's the title of your book when you write it, Biljana. How much is too much?
How much is too much? Yeah, right.
I'm going to read it.
Good.
I'm looking forward to it. That's going to be, you can have that. That's definitely yours.
Let's find the time for that.
Let's just bring our listeners to sort of all of the information that you've just so expertly explained to us, Biljana, specifically in relation to all of the other factors in the rest of the body and how that links and contributes to how the pelvic floor function works, specifically in relation to active females. You've touched on a lot of that we've just spoken about. So for those of you listening here, a lot of what you spoke about is referenced in this article of yours here, Biljana. So in a very good way, you've covered about 10 of the questions that we had written down. You've covered all of that there, which is great. So this is an additional article in the autumn 2022 edition of Journal of Pelvic Obstetric and Gynecological Physiotherapy. So if you're listening to that and you're really wanting to delve a little bit more into the information that Biljana has explained to us there, there's a lot of that content in terms of rib cage, breathing, biopsychosocial factors, and all of those elements are in that article that people can have a look through. So right towards the end of that, you mentioned the book that you are writing a chapter in, and you're writing that with Tim. What's Tim's surname again?
Tim Gabbett and Taylor. Yeah.
So tell us about the process as well as the content. Elisa and I have written our own book. I've written chapters in a number of other books as well. And I don't think if you haven't gone through the process, it's hard to understand just what it's like, because it does, often it's quite an honor when you're asked to write a chapter in a book or to write expert opinion in things. But it is quite a lot of work that goes into what people read in a book. So why don't you tell us about how that came about and what your chapter is focusing on.
I think it came about with Gráinne Donnelly, our pelvic health, really a lead in research in a female athlete, approached me and asked me to consider maybe writing a load management, because I started that conversation with Tim Gubbett. I think it was in 2020 when I met Tim, just before COVID actually, and I just wanted to attend load management because I treat quite a lot of sports people, and quite a lot of them are from the Olympic teams that come to me incognito because they feel embarrassed to tell their coach or their Olympic team, medical team, because they don't have a pelvic health physio, or they don't know how to talk about the symptoms, or they feel they are going to be discriminated against just a symptom of pelvic health, as they say it. So then I would take them and got a little bit more into the sports performance, strength and conditioning, and met Tim Gubbett. And of course, I was putting my hand up all the time during his course and asking questions related to pelvic floor, whereas everyone else was there from a different musculoskeletal and sports background. So Tim and I ended up actually having a long conversation about that. And as a result, I wrote an interview with him, and that caused interest and a little bit of a turbulence in pelvic health, in terms of like, oh, how do we define chronic load? How do we define acute load in pelvic health? It's a fair point, because if we are doing this for any other muscle and for the whole body, we should be able to apply it in our population too. And then I started looking into it kind of like more from in clinical practice, and I started kind of changing the tests that we had in order to define what would be an acute or chronic load for my patient with pelvic organ prolapse who wants to go back to running. And this is how it all started. So the conference paper came out, and I need to just say in relation to that conference paper that all the work that I've done behind it and all the tests that I use are very individualized. They're not validated. So this is very clinical work. So I'm talking from the clinical experience and clinical observation. And this is why I think Gráinne recognized that we need to talk about it and we need to see how we can validate. At the same time, Bill Taylor, a really known physio in the UK, is doing a similar thing like me, but we have slightly different approaches in how we are defining or how we are measuring, for example, acute and acute load, and how much we push actually to get the symptoms, but very much it's in line with strength and conditioning approach. So we teamed up in order to sit down and write this chapter. It's very much still in progress. And we divided our basically tasks into, obviously Tim is coming from a really solid background in load management. So he's going to talk in general about that. He already wrote an amazing part, but now we need to actually justify why Bill and I are doing what we are doing in different sports and different performance. How can we justify and pull out the way we can validate some of the testing and validate some of the approaches. So we are literally opening the door for a research. So we are talking the basis of the theory, what we are doing in the practice, what outcomes we are seeing, and maybe giving suggestions for further validations and research. So it's going to be, yeah. So hopefully we are giving a real examples from real world, so that people can actually picture and visualize what you do with the patient, and different performance and how we return them back to competing. Wow.
Fascinating. Well, you're going to have to make sure that you let us know when it actually is out, and we can let all of our listeners know as well. Look, there is so much more we could talk over, and so much more we wanted to talk over. But I am conscious of time here. I know you're a very busy person. Our listeners will have time constraints on what they have as well. So well, I think it's probably best for now, if we pause the exploration of your brain for a moment, and we will obviously have to come back and do another podcast with you and keep going, because there's the fascinating paper that you've got there where you actually take it from a different viewpoint and look at the ACL rehab, which is a really interesting concept and an interesting article to talk about how you incorporated Pilates into that I think it's in a postpartum client, I think.
It's in a postpartum.
Very exciting for me to read.
Yeah, she is. She actually found me through APPI, believe it or not. Her sister is a physio. So when it happened to her, she called me and she said, listen, I'm based in Zurich, but my sister is a physio and she knows you from APPI. She told me I need to contact you. So luckily she agreed.
I love when the network works like that.
Yeah.
But obviously if those of you that are listening have been as enthralled as we have and excited by everything that they've heard here, we have a bunch of programs in and around some of the conversations that we've been having here. We have the entire women's health certification now that Biljana and our amazing team of women's health therapists have put together for us. So you can explore that. But a lot of people will want to follow your journey a little more specifically, Biljana. How can people follow you, learn more about you, website, Instagram, all that sort of stuff? How can people continue to get inside this amazing brain of yours?
Thank you. I was on Twitter for a long time. I was like really hot on Twitter all the time, really dependent on it. But unfortunately, when it became X, I don't like X's, so I left out. I'm on LinkedIn. That's the only social media I use at the moment, simply because of the time. And I think that's the best platform. And my website is bkennaway.net. Again, not much time to update everything, but I'm around. PureGP platform is the best as well. So some of, all our work will be there. And obviously APPI. I'll be here.
Yes. Excellent. Well, look, it has been an absolute pleasure and an honor to have you on Pilates 101. We really greatly appreciate you giving us your time. We appreciate how busy you are. So from myself, I'm sure on behalf of Kristina and all of us here at the APPI family, we thank you very much for giving us your expertise and your time on Pilates 101 today.
Thank you all for having me. It was
Thank you so much.
It was really nice to see you all again.
Yes, and you. All right, we'll come back and wrap up all together shortly. All right, welcome back to you all. I mean, honestly, the main thing I feel right now is just a little bit inadequate. Got to be honest.
Yes, Glenn.
Tell me your views. Tell us what you think about that, John.
I'm about to go and apply for scholarships. I'm about to just finish my PhD. I'm about to find myself a time turner and win the lottery. I won't quit my job, Glenn, don't worry, I'll stick around. But yes, she is incredible. She is, I really hope you guys enjoyed it as much as I did, because it's fascinating as well, because the research that she discusses is so relevant for so many areas, and I kind of would struggle to think of a listener out there who's just listened to that interview who doesn't appreciate the importance of some of the research that she's done and couldn't really put that into a practical setting where they work. It's fantastic.
Yeah, absolutely. I thought it was just, it was really great how she continued to challenge herself. And I say this, I don't know, rightly or wrongly, but I do continuously ask my kids, just keep asking questions, keep asking why, and never settle for the standard. Do that little bit extra and you'll go far in life. But oh my gosh, she just kept asking questions, didn't she? And she kept challenging not just herself, but those around her, and kept finding those avenues of how to continue to progress herself, which I really found quite inspirational in that constant thirst for knowledge that she was after.
And she's still asking the questions. And when she finds an answer or evidence to back up something which is thought of or figured out, she's then sharing it, and which probably provides more questions at the end, which is that continuous sharing of information. And some of the lecturing spots that she's working with now it's incredible, really fantastic.
Yeah, it is. And I mean, as you said, that stuff that, I love hearing stories when people have gone outside of what you expect. She's gone into the corporate world. She's delivering seminars in that sort of environment as well. She's got a successful physio and Pilates clinic. She's still teaching and talking and researching. So she's got so many sort of avenues that I think is hopefully what you guys listening to that conversation and listening to us here can keep thinking about, that there's always another opportunity, and you don't always have to take it. It's like Dawn said in the previous episode, you'll get to a point where hopefully you're happy and you're like, right, I'm happy here, I'm satisfied here. But maybe you're not, and maybe you're only thinking about working in a physio clinic or working in a Pilates studio, whereas Biljana showed us that, well, this great profession that we're all involved in can take you anywhere. It can take you into research, into lecturing, into corporate wellness initiatives. There's so much that really, when I hear her speak, a comment keeps going through my brain a little bit, is often the only thing holding a person back is themselves. And I think Biljana sort of really epitomized that concept, as though if you're sat there and you're thinking, I want something, but I don't know what it is, well, so much that you could go and do. And she's gone and paved that way for herself.
So that's really good. And if you try that, they don't know what it is that you want to go and do, maybe then figure out a question instead. So there's something I like to do. Why do I do that? What is it about this that works, or why do I enjoy doing it? And maybe build off of that in terms of what can I do next? Going back to the why. Why? Maybe that would take you somewhere.
Yeah, absolutely. Well, look, I've thoroughly enjoyed the conversation that we've had with Biljana there. I think we all need to go and get a white piece of paper out and start reflecting and writing down just what it is we want to achieve out of life. But
yeah.
Yes, a really, a great chat, a great person as well. I think that's the other.
Thank you, Biljana. Thank you.
Really great person, right? Really great. And we've seen that in our two guests so far this year, like humble, honest, achieving great things, but just both. Of course, we know them, so we know that it is true. But they also bring that across in the interview, don't they? Just a genuinely good person who's out there making the world a better place.
Yeah, really, really is just like having a chat with them, which is what we want this podcast to be, right? It's a lovely, free-flowing, nothing structured, but that's the kind of conversation you would have with them just over coffee. Really nice. Very
good. Well, look, that's it for this month. We will see you again early March, and I'm delighted to keep sharing insights, innovation, ideas, and anything of interest. As we say at the end of every episode, if there's anyone specific you want us to invite on for a chat, please
do
the best we can to get them on board as well. For now, keep your own Pilates practice up. I think that's one thing as teachers that we often can let slip. So let's keep up your own practice, keep your own bodies in good working order as you do to help everyone else. Kristina, thank you for your time again.
Thank you, guys. See you soon.
See you soon, guys. We'll see you in March. Bye for now.